Dr. Raymond Givens, and he's a cardiologist at Emory University School of Medicine, and is also one of the leading voices calling attention to what many say is a problem of racism in the medical journal industry, that is. Now, Dr. Givens, thank you so much for being with us today.
Thank you for having me.
Can you start off by explaining what the physicians like yourself mean when you say that there is a problem of racism in medical journals, and can you give us maybe some examples of that?
Yeah, well, so firstly, I want to say that I actually want to thank you for using the word racism. I mean, that's a term that we seem to skirt around and are afraid to use, and we'll use all kinds of other colloquialisms. But, to be honest, I've become more and more convinced that it's a problem of racism, of white supremacy, if you want to make it that specific. I think the problem that I have highlighted is just the stark lack of diversity on editorial boards for these major journals, and that matters because it's about the insight that people have in terms of deciding what should be published, what's appropriate, what's not appropriate. And that's more than happenstance. It's more than just an accident. Other research that I'm hopefully going to be publishing soon shows that it's more than just that there's a lack of diversity, but if you look at kind of the networks of, how people relate to each other among these journals, white people, specifically white men, are really at the very center of these networks, and non-white people are kind of at the periphery. And when you're talking about black editors at major journals, they're very few and they're very peripheral by and large. In terms of examples, from say the past year, one that certainly stands out that comes to mind right at the top is there was a research letter published in Journal of the American Medical Association last year that looked at expression of a particular gene that's been implicated in the entry of the COVID-19 virus into cells, and found that the expression of this gene, if you look at cells taken from the noses of people of different ethnicities, the expression level was highest among African Americans, higher than for every other group. And what this group then said, of course, is that, well, maybe this explains why there's such a higher rate of COVID-19 infection among African Americans. Now, predictably, people got upset and, said that this was conflating, race with genetics, et cetera. For me, it was just much simpler. I forget about being offended. I care about the science, and the science here doesn't make any sense. So beyond, it's not, of course, just African Americans who had been known to have, outsized infection rates, but so did Latinx people.
Well, let me ask you this. We're trying to get that information out there and tell people that these things are happening, these disparities, but the editor-in-chief of the Journal of American Medicine, he actually resigned earlier this year following a scandal around race and major medical journals, and a lot of people have said that they've just made a course correction, if you will. So what do you think about their responses to this, and is it really helping solve the problem at all?
Sorry, just let me finish that very briefly. The rates of expression, gene expression, were no higher than the Latinx people. So it just made no sense. And you wondered, how did this get across? Anyhow, when it came to the resignation of Howard Bachner, the editor-in-chief of JAMA, now, so I had been in contact with the editors-in-chief of JAMA and New England Journal of Medicine going back to October of last year, really presenting them with this data and saying that you have a problem here. You have these blind spots that you're not recognizing, and something may be coming down the pike that you're not going to see coming, and didn't really get much of a response. Lo and behold, there was a podcast earlier this year on structural racism that was just a disaster. I'll skip the details, but I came back and said, so now it's happened to JAMA, and ultimately that led to Howard Bachner, the editor-in-chief, resigning. For me, I don't think that's a solution. That's one person who really is just a symptom of a larger disease, which is the sickness of the JAMA network and medicine more broadly. What I've seen since then is that indeed it hasn't really fixed anything, and that's some of the other feedback I've given to them, which is, to be quite frank, I think that the whole slate needs to be turned over at that network. The same blind spots, the same lack of insight, bad judgment persist.
Yeah, well, that's why we need people like you who can blow the whistles on issues like this and bring it to our awareness. We're out of time. We definitely have to have you back, Dr. Givens, to talk more about this and the work that you're currently doing. So thank you so much for joining us tonight. And be sure to join the conversation. We want to hear from you. Head over to our BNC Instagram and Twitter pages to let us know how you feel. Also visit our website, bnc.tv, and subscribe to our YouTube page and check out clips from the show.